Good afternoon, Care Credit Sales Team. This is Dr. Douglas Beck. I am the co-host of the Hearing Matters podcast, and I've been an audiologist for just over 40 years. Anyway, listen, I was asked to do a little video to talk about what's going on in the profession of audiology and hearing aid dispensing and in the industry of hearing aids and related matters. So I'll give you a couple of things. Number one, you should know that over-the-counter hearing aids, which are now legal, of course, really haven't impacted the prescription market at all. The sales of prescription hearing aids, that's professionally dispensed hearing aid, go up 3 to 5% every year, and they always have done that. And that's still going on in 2024. And that's per the HIA, the Hearing Industry Association. And I know a lot of audiologists and a lot of dispensers, and they tell me the same thing. They are so busy, it's ridiculous. So the question you might ask is, well, why would somebody go see a professional if they have OTC available? Well, OTC basically is generic, one size fits all, and then you get to tune it up a little bit. But they're connected most often, right? They're a little tiny thing like a rick or a right, something like this. This is a receiver in the canal or a receiver in the ear type of hearing aid. And you can tune it up a little bit on your phone, but the problem is that it's never the very best hearing aid for anybody because it was never programmed specifically for that hearing loss, and it was never custom fitted to that person's ear canal. The people who are getting OTC, I think, are a very different set of patients than the people who would ordinarily see a hearing care professional. I think the people who buy over-the-counter hearing aids most often are looking for an inexpensive solution, and for them it might be fine because it just makes things louder. However, there's a lot more to getting somebody to wear hearing aids for the whole day and for every day. It's not just, can I make it louder in a specific situation? It's, is it comfortable physically? Does it improve my signal to noise ratio? Do I feel like I can hear better? Do I feel like I can better attend to the signal I'm interested in? These are things that essentially are always best done by custom fittings. So people with significant hearing loss who are speaking to a hearing care professional, that marketplace is increasing as it always has. And I'll give you a quick demo of how good custom-made, professionally fitted hearing aids can be. And I'll use myself as an example. So I don't think you can see my hearing aids, right? Let's go to this side now. So maybe they're showing, maybe they're not. I can't see when I'm not looking at the camera. But I can tell you, this is in my ear canal, and this is a deep fitting. What happens is when we have a video otoscope and we can take a deep fitting, a deep impression all the way to the ear canal, past the second bend, you can make products like this. Why is that important? Well, when you take a deep canal fitting, you are able to reduce the area between the hearing aid and the eardrum. As that gets smaller and smaller and smaller, you need less power, less gain, which means you're going to have less feedback. Once you have a custom fitting, if they do have occlusion, or if you need to for other reasons, you can vent it. Mine are vented. Here's my left one. I'll show you. I don't think the vent's going to show, but I'll try to show you on the camera. See that little hole there where the string is coming out? That's a removal string. That little hole there, that allows me to have a vent, which helps to keep the sound comfortable. It allows pressure to go in and out past the hearing aid, and it keeps it very comfortable when you fly, because instead of having Toynbee and Valsalva effects, which is a decrease and increase of pressure in your middle ear space through your eustachian tube, through your nasopharyngeal passages, instead of that being a problem, because it's vented, it stays equal pressure on both sides, inside the hearing aid fitting and outside. So this happens to be a Starkey product, and I'll tell you what, the control that I have when I program these is vastly superior to any OTC product I've programmed. Now, to be fair, I've only programmed about 8 different OTCs that were given to me by OTC manufacturers to see if I would endorse them. I can't, and I won't. I'm not going to endorse something that I wouldn't wear. So that's the OTC discussion. And I think that for the people who you're speaking with at Care Credit, and when you're speaking to audiologists and hearing care professionals, I really think emphasizing custom products is a good way to go. Because, if they're worried about their business and they think, oh, we don't need Care Credit because all the products are going to be under $500, that's not true. The market for prescription hearing aids continues to grow. And the products keep getting better and better as far as the custom fit and the professional quality products. And then I want to talk about in the USA, we have about 330, 335 million people. About 38 million of them, maybe 40 million, have hearing loss on an audiogram. So that's important to know. However, there's another 26 million people in the USA who do not have any hearing loss on an audiogram, but they have listening disorders and they have hearing difficulty and they have difficulty understanding speech and noise. 26 million. I've been writing about it for 30 years, but many audiologists are just starting to realize that when you test deeper than traditional tests, when you do the entire best practice protocol, whether you're doing AAA, ASHA, or IHS best practices, you're supposed to be doing listening and communication assessments. You're supposed to be doing speech and noise testing. Those are best practices by all three major national groups. When you start to do that, you see people who have speech and noise problems without any hearing loss on an audiogram. And what we know, there are people with normal thresholds who, if given a better processing to improve the speech and noise or the signal to noise ratio, they'll get by better in more challenging and difficult situations. So the idea of minimal fits and minimal gain is gaining popularity in audiology because it makes sense. When somebody has attention deficit disorder, they have dyslexia, they have perhaps mild cognitive impairment, when they have any sort of Parkinson's with dementia, or dementias like Alzheimer's or Lewy body disorders or frontotemporal dementias, they have a harder time processing information. They have a harder time making sense of speech. Now, what I'm telling you is not that they all need hearing aids. Absolutely not. That's ridiculous. But I'm saying that if we were to test some of them and with the entire best practice protocol, we'd find many, I'm sure, who would have relatively normal thresholds, that have difficulty understanding speech in noise. And for those people, you might put a pocket talker on them. You might put, a generic OTC on them. You might put a custom fitting on them. And the purpose is not to make things louder. The purpose is to improve the signal to noise ratio to make things clearer. So those would be the overview of messages that I'd offer for you as hopefully something that you can grow from and use as foundational discussion points with audiologists and hearing aid dispensers, is to focus on custom fittings. And in the Hearing Matters podcast, we're going to have some photos available if you want to see what my ear looks like and how those impressions are taken. And I think a lot of offices have fallen into every patient gets a RIC or a right? And they are generic micro BTEs. And why is that good for the manufacturers? Well, they're larger, they're easier to make, there's no customization, and they can fit a vast range of patients with that one product. So the manufacturers are pretty much, delighted to make products like that. And it certainly takes more skill, more time, and more expense to make a custom product. But a custom product is almost always a better solution for every patient. I hope you have a joyful and safe 4th of July. And, any old time you all want to talk about the details of hearing healthcare, hearing aids, and best practice recommendations, I'd be delighted to speak with you. Have a great day.